Hey everybody, it's Dr. Quinn here. I wanted to review something with you guys because as a patient, it can be very confusing how long something's going to take to heal. And my job as a doctor and all the doctors here is to figure out, first off, what's going on in your body, why something might hurt, or maybe why something doesn't hurt, or what tissue type is injured. And there's a couple different things that you have to know. So just starting off, it's different types of tissue heal at different rates. So something like your skin or muscle tends to heal fairly quickly. Muscle tends to heal within 3 days to about a week or so. So I always think about it like if you go to the gym and you start working out really hard, you're lifting weights, technically you're tearing some of those tissue fibers, and then the body goes and starts to heal that. That's how you actually grow bigger muscles, by working those muscles out. But that usually heals in about a week. So the general rule for us is if there's anything that's longer than a week of pain, probably means that there's something else going on, and that could be a couple different things. One is bone inflammation, tendon, and ligament are the other big ones. Also nerve injuries are very severe as well, but the big ones that we see all the time are ligament and tendon injuries too. And those get tricky because with those kinds of tissues, it might take only, if you only get a grade 1 sprain, that might only take 3 months to heal. But it can take up to 6 months in some cases, especially if you have a repetitive stress that you're doing or you keep doing the same motion that created that inflammation in the first place. So the other big things for me is if you're not drinking water, if your nutrition's off, and you don't have the right building blocks to repair that kind of tissue, then it can be really difficult for the body to go in and start healing that. It's like trying to build a house when you don't have any wood and you're just trying to grab random things, rocks and bricks, and just trying to mix something together. So we do see injuries that if they don't heal properly, you get bone spurs, you've got calcium that gets deposited inside of the muscle or in the tendon. These can all be complications, and we usually see those on x-rays after injuries and those kinds of things. So here's the other thing that I would like to discuss with the patients, because sometimes your pain goes down at a fairly fast rate, and the way that the body heals, it's kind of 3 phases. You have the first phase, which is kind of the inflammatory phase. That's like if you rolled your ankle and your ankle was really swollen and irritated, you would see that swelling, the redness, the heat, and all that tells you is that there's a lot of cells going in there to try and heal that tissue. So sometimes pain's your best friend because it tells you that you're healing something. The problem is once you get past that inflammatory phase, the next phase is the repair phase. So I use the analogy a lot of times that it's like if you get a cut in your arm. The cut usually only hurts at first for a couple of days when it's all red and irritated. Once you get a scab, that's when you're in that repair phase. Now it's hard because as a patient and as a human being, we can't see what's going on underneath the skin unless you have advanced imaging and that kind of stuff. And that's where our hand skills come into play, because we can challenge the tissue and know what's irritated just based off of getting hands-on, moving your guys' bodies around, and seeing what recreates that symptom. But the problem is once the pain's gone, a lot of times you forget that you had that injury. And that can be an issue because if that tissue is still healing and we start working on you and you start feeling really good, you might think that it's completely gone at that point. So when people walk out of our offices, a lot of times they're feeling great. Well, you might still have that injury that's healing. It's like a scab again. And if you go and you pull on that tissue right afterwards, it's like taking the scab and pulling your scab off again. And now you've kind of restarted that healing process. And that can mean it takes twice as long, 3 times longer, or indefinitely longer to heal a tissue if you just keep pulling on it. So we do a lot of education here at our office. We're really good at being able to check something and diagnose properly. So please come in, get checked out. Don't wait until it's too late. And also don't assume that just because it doesn't hurt doesn't mean you don't have something going on. That's another difficult thing. So come get checked out. Let us work on you, get you out there feeling better for your summertime, and so you can go out and adventure and do some more fun stuff.